Hello, my name is Xiaoman Lancaster, and I'm talking about nitroglycerin today. Nitroglycerin is used primarily for the use in preventing heart attacks, specifically angina, which is a tight chest pain associated with an oncoming heart attack due to blockage or narrowing of blood vessels. It is usually found in a dissolvable tablet form, but there are also other forms which treat different symptoms or conditions. All nitroglycerin products must be obtained by a pharmacy or hospital with prescription and must be kept in light-proof containers. It is possible for the body to build up tolerance to nitroglycerin, so it is not to be used too frequently, and nitroglycerin that we know of today wasn't solidified and made for medical use until 1998. Nitroglycerin is composed of 3 carbons, 5 hydrogens, 3 nitrogens, and 9 oxygens. When having heart attack symptoms, the nitroglycerin tablet is put between the cheek and the gum to dissolve. It is then converted into nitric oxide in the smooth muscle of your vessels. Then it activates the guanylyl cyclase enzyme, which is responsible for calcium levels and converting GTP, which is guanosine triphosphate, to cGMP, which then increases the secondary messenger cGMP, which is cyclic guanosine monophosphate concentration, which tells the vessel wall to relax and expand their muscles. The dilated veins then help decrease the ventricular volume and decrease the oxygen levels required to pump the blood through the body. It helps improve myocardial blood distribution to the heart, and symptoms should go away within a few minutes with no more than 3 doses of 1 pill each with 5 minutes between each dose. An example when someone would want to use nitroglycerin would be if someone was having chest pain called angina, or heart attack symptoms such as shortness of breath, tingling in the left arm, loss of concentration, or heartburn-like symptoms. Then it might be necessary to take them to the hospital to get a nitroglycerin tablet. The tablet will then dissolve and make its way into the smooth muscles of their blood vessels. It releases an enzyme that sends messages to the vessel walls to dilate and increase blood flow to the heart while lowering the oxygen needed to pump the blood. This lets the person's heart not be strained and can be a quick fix if their blood vessels are filled with plaque or are narrowing. A good summary about nitroglycerin is that it's mainly used to treat the chest pain that can be brought on by heart attacks. It converts the nitric oxide in the blood vessels, which then relaxes the walls and allows increased blood flow to the heart. And heart attacks are caused when blood vessels close or narrow too much and strain the heart into trying to pump more blood. After the walls dilate, it only takes a few minutes for the symptoms to decrease. Once someone has had a heart attack, they are more likely to have another, so they can be prescribed nitroglycerin to carry with them in case of an emergency. The nitroglycerin must be stored in a dark, dry, and cool temperature because it becomes less effective after 6 months. If the person acquires a tolerance to nitroglycerin, other medications must be used or other interventions. And here are some references for my slideshow.